Hello friends. So having a fracture of a leg is a very unfortunate event, and if somebody sustains an injury, the first question that comes to their mind is, will I be okay? Will I be able to walk again? This story is of a middle-aged gentleman who had sustained a leg fracture, which is a proximal tibia fracture just below the knee, and there was displaced fragment. It was moved from its position. So we operated with a minimally invasive method, which is sliding plate technique, using titanium plates and screws, and were able to restore the normal alignment and normal shape of the bone. He went on to have complete fracture union. He was able to sit cross-legged, bend his knees, and do his routine activities without any pain. This is an example of how you can recover from a major fracture of the leg. If you or your loved ones have sustained such an injury, do consult your orthopedic surgeon today.